Hello everyone, welcome to our presentations of Team 3. Our topic is communicating with persons. Our team has 5 members. The first member is Nam. Second member is Oanh. The third member is Thảo. The fourth member is Quỳnh. And the last member is Chang. Our presentation is divided into 4 parts. Part 1, the importance of communication with the persons. Part 2 is communication situations between doctor and person. Part 3 is cause miscommunications, and last, how to improve communications. So first, Nam will talk about the importance of communications with the persons.
Communicating means share information with others by speaking, writing, moving the body, or using signal to talking about your thoughts and feelings. It helps other people understand them. Today, I only want to talking about communicating with patients. Before, people believe that your doctor was to make the correct diagnosis. They didn't have to communicating with patient. Shouldn't ask the patient how they were feeling or what they thinking about your whole procedure. Fortunately, now we know that things are not so simple. Your patient is not a machine that just needs repair. If you want to know the patient problem, you must communicate with patient. Communication is the most important component of our work with patients. Is the cornerstone of our interaction with people. A good and an effective exchange with people help them see that the other person thinking, other person thinks, and how they feel. It helps people understand each other better and bring them closer. Specifically, first, communication is integral to all aspects of the patient care. True communication is a core clinical skill that can be developed and improved with practice, experience, continuous learning, mentorships, and support. 3. Effective communication has a significant positive influence on the patient experience and satisfaction. The last one, poor communications contribute to teamwork failures, errors, misdiagnosis, and inappropriate treatment.
A more detailed analysis be what a conversation talking about communicating with patients, including Dr. Oanh and patient Thảo.
Next person. Yes, good morning. What's your name?
Good morning, doctor. My name is Thảo.
Yes. How can I help you, Mr. Thảo?
I have been having abdominal pain.
How long have you been abdominal pain?
Yesterday I felt a joint, but this morning I feel stiff pain, so I went to the doctor.
How do you feel now?
I'm very painful until now. I can't eat anything.
Yes. That is serious. Where on the abdomen do you have pain?
I'm in pain here, doctor.
Oh, is here? Yes. Do you have any other symptoms?
Symptom?
Besides that, do you have your discomfort anywhere else?
Oh, I have a nausea and vomiting after eating, and I have a burning sensation in my stomach.
Oh, not nauseous and vomiting. Have you ever been like this?
No, this is the first time.
Okay. Do you have any treatment at home?
Oh, yeah. I took medicines, but it didn't help.
What medicine did you take?
No, I don't know.
Oh, yes. I think maybe you have a stomach problem, and I will flag your some test to know the stress disease. You have anyone to go with?
Yeah, I come here with my husband.
Oh, okay. Where is he?
He waiting for me outside.
Okay. Do you have a health insurance card?
Oh no, I don't bring it.
Oh, wow. Now, go do the test. Okay. Outside, the review notes like you photos. When you have a result, please bring some here and soap and check.
Okay.
Now.
I think the doctor is about conversation also made some mistake in communication. Not focused on communication, talking to patient while using the computer. No empathy and understanding with the patient. The doctor is too serious. Use jargon that is difficult for the patient understand and has to ask again. Like the term symptom instead of how do we feel. Talking to face, asking many questions. Not paying attention to body language. Here are some common mistakes made in doctor-patient communication. Not really listening, empathizing with the patient. Keep turn back and looking at the computer screen while the patient is trying to talking too quickly with the patient and not giving the patient time to answer questions. Ask only no question. For no question, the patient only needs to answer yes or no. Communication medical jargon when not necessary. For example, using terms such as urticaria and myocardial infection instead of ear pain and heart attack when unnecessary, informing patient of their condition while when communicate clear communication. This many helpful or find the patient will not use simple picture for medical instructions that can enhance patient understand graphics should research and explain the concept in the text and should never be attacked or for declared verbally. Not paying attention to body language, small detail as simple, not making eye contact with your patient can damage the rapport between you and your patient.
Learning how to improve communication skills will make you a better nurse by enabling you to better understand your patient's needs. Considering your patient's perspective is key to preventing encounter that resemble any kind of conflict, and sometimes the best way to achieve that is to quite literally get on the level. You can do this by practicing the following.
The first, be aware of how your verbal and non-verbal cues are affecting the interactions. The second, take care with the opening greeting as it can set the stand for what follows. It may assist or inhibit rapport. Generally, it has to be warm and welcoming so as to put the patient at ease. The third, listen first and don't interrupt. Let the patient tell his or her story and allow them time to find the right words to explain their symptoms or recall medical history. Listen carefully and pay attention to nonverbal cues as well. The first, assess your body language. If necessary, sit in a chair so that you can be face to face and making eye contact.
5. Establish a good rapport with the person. Persons thrive better in a therapeutic environment. 6. Show empathy and understanding at all times. 7. Don't talk too fast. It is important for you to take the time to explain important information very slowly and don't rush through negative information just because it is unpleasant. 8. Make your interactions easier for them. Keep your sentences and questions short. Stay on topics at a time and explain difficult concepts in clear terms.
So that the proper request accommodates the request as is safe and prudent, rather than speak in common of some trust. Have a patient due to the age, illness, or cognitive difficulty, they may move and speak more slowly than you do. Give them time to move at the pace need not be rushed. 5. Provide simple writing instructions when necessary. Use graphics when possible. Patients coming out of surgery or chamber are less likely to remember everything you told them, and easy to follow list of the basic concepts you discussed. Will have to ensure compliance with the plan of care. Give your patient ample time to respond or ask questions. This will help them feel like a valuable partner in the management of their own health and make communication effectively more likely.
It's important to tailor your communication and consider your health, literacy, needs of patient, families, and care.
In growing an opportunity to clarify the information provided and to check understanding.
Communicating with kindness and empathy with patients and their families and your colleagues.
Including these strategies in your patient communication will strengthen the ability to provide the best possible care for your patient and make them feel like the valued partner in their own care that they are. It will also improve the experience with you and the nursing service provided by your facility, which can be beneficial to the patient score.
It will also improve their experience with you and the nursing service provided by your facilities, which can be beneficial to the person satisfaction scores. Thanks for watching our presentations. Bye.
As always, thank you for watching.